Rejuvenation really means a combination of both surgical and non-surgical treatments, and they are often offered as a combination. And the non-surgical treatments normally come in just before the surgery or just after the surgery. The surgical options for rejuvenation are really around work around the eyelids, both upper and lower eyelid surgery, rhinoplasty surgery to change the shape and the function of the nose, and then surgery to the ears and surgery to the face. And facelifting procedures are various, from local anaesthetic procedures all the way up to a full general anaesthetic. And the particular procedures all have in common that the layer underneath the skin is tightened, and then the skin, having been elevated, is then reinserted and sutured into place. The most popular surgical facial rejuvenation treatments are eyelid surgery. A very good entry-level procedure is an upper eyelid blepharoplasty, which can be done under local anaesthetic, takes about 40 minutes, and involves usually an excision of a small cuff of skin and a bit of fat on occasion. The wound is then closed directly, and those stitches come out at 1 week. That's a very good treatment. It opens up the eyes and the risks are very low. Moving on from eyelid surgery, obviously there are short scar facelift procedures which involve an incision in front of the ear and a small incision under the chin. And via these two incisions, the skin is elevated, the layer underneath is tightened using sutures, and then the skin is redraped and any excess removed. That operation takes between 90 minutes to 2 hours. And again, the risks of this procedure, because we're operating in a very superficial plane, the risks of these are very small. The rehab period is normally 1 to 2 weeks. So this is the absolute gold standard question that patients ask their surgeon. And what the surgeon must do is not oversell the treatment. The very reason the patient is sitting in front of you is because they have skin damage due to the sun, and they have lost the elasticity in their skin, and therefore their skin is descending. So it would be very naive to suggest that as long as you pull on the skin, such a repair will last for 10 years plus. This isn't the case. What you need to say to the patient is that you will put back their facial appearance by at least 5 to 10 years, but they will go on aging at the rate they're currently aging at. And so really, they need to understand that no guarantee can be made regarding the longevity of the facelift. It is about putting them back to a time before that one is really trying to achieve. So there are risks and side effects associated with any operation. And the issue one has with someone undergoing facelifting surgery, rejuvenation surgery, is these are non-essential procedures that are being done and being offered, but occasionally complications will occur. And these are commonly around things like bleeding or infection. Now, these are usually eminently treatable, and the final outcome isn't affected by that, but occasionally it can be affected, and patients need to understand that they are going through a very formal consent process with the surgeon to ensure they understand that there are risks associated with procedures which the surgeon should discuss with the patient, and that on occasion they can end up with a poor result. This risk is very small, but nevertheless it is something that should be discussed and not avoided. Well, the most important thing, I think, to determine whether or not you're a good candidate is to seek advice from a reputable surgeon, and there is a website of all reputable plastic surgeons that belong to a association called the British Association of Aesthetic Plastic Surgeons, BAAPS. We're on that website, and seeing at least 2 people for opinions is important. Only seeing one person puts you at risk of being told one option. You need to see several people so that you can get a better feel for what options are out there available to you.